I came to mindfulness through a combination of my personal and professional journeys and discovered it as a vital tool to enable my own health and well-being and that of others. I then went to extensively study and train to teach mindfulness, and I'll share some of my findings in this short session. I think probably the light bulb moment was working as a pharmacist and discovering the existence of what we called a fast mover shelf, which was piled high with antidepressants, painkillers, and blood pressure medicines. And it really struck me that so many people were taking these medicines, and why was that the case? And I developed an interest in the link between stress and disease, which also linked into the exploration of mindfulness as a tool to reduce stress. So, vitally important throughout this session and always when practicing mindfulness is to prioritize your self-care and just to notice anything that feels right for you or not and choose wisely. And to bring attitudes of kindness, curiosity, and as best you can, non-judgment to your experience as it is in any given moment. These are really important attitudinal qualities of mindfulness practice. And I'd invite you to always stay connected to your instinct or gut feeling in helping you to choose wisely. So to begin with, I'll give you some options for a very short mindfulness practice to help us arrive. So you might notice that your mind is still thinking about what you've done before you came to this session or what you might do after, which is very common. And in mindfulness, we're training to be able to become more present more often. So, options for you to choose. You may like to sit and spend some time looking at this beautiful photograph of one of my favorite spots to practice being present. You could set the intention just to see what's in the image and notice your experience, remembering with kindness and curiosity and non-judgment. And when any thoughts come up, just noticing them, gently letting them go to one side and bringing your attention back to focusing on this image and noticing your experience in body and mind. The second option, just spend a few moments of quiet to yourself, zone out my voice if you choose to, just to give yourself time to settle. And the third option, if you might like to soften your gaze or gently allow the eyes to close, an invitation to take your attention inward into the body, to feel the connection of the chair and the floor, moving from the head to fill the whole body with awareness, the weight coming down, a sense of grounding, but lengthening through the upper body as we adopt a relaxed but awake and alert sitting posture is our intention. And with that kindness, curiosity, noticing any judgment of what is here now, tension in the body, a busy mind, an invitation just to surrender to gravity, to allow the body to be supported by the chair, the floor, just arriving in this moment, letting go what went before, leaving the future for later, and settling into this moment. Just being here now and checking in with yourself and noticing how the feeling tone can change moment by moment. And there's no expectation or right way to be or to experience. It's simply about noticing what's here now and being present in this moment with curiosity, kindness, letting go of any judgment. And if your eyes are closed now, inviting you to open them to really bring your attention to the screen, to the words, to the rest of the session. Maybe just taking a deep breath if you've noticed the breath was shallow because you've been busy or stressed. And we'll move on. So, for those of you who are perhaps new to mindfulness, I'll just offer a definition here from the late Zen master Thich Nhat Hanh. This was a photo I took on my first retreat back in 2008, an old photograph of an amazing experience when we were fortunate that Thich Nhat Hanh and his community of interbeing came and guided a retreat for us in Nottingham in the UK. And that was my first deep dive into mindfulness. I'd been reading about it and practicing, but it was on this week that I learned so much about mindfulness as medicine and about the power of mindfulness and what it can offer us. So Thich Nhat Hanh, or Thai as he's known, which means teacher, defines mindfulness as the practice of being fully present and alive, body and mind united. Interesting that he describes mindfulness as energy and that this energy helps us to know what's going on in the present moment. And this can be so empowering. The word discernment is often used, and having this awareness of the moment, the present moment, and your full experience can really help us to make wise decisions and free us up for creativity and insight. So, who are we and what is this mindfulness? It's often seen as a technique. And while there are mindfulness practices that can look very much like tools or techniques, mindfulness itself is much broader than that and actually an inherent part of being human. So if we think about the genus of our species, Homo sapiens sapiens, sapiens actually means wise, discerning, and or knowing. So as a species, we are aware, but not just that, we know that we're aware, hence sapiens sapiens. So it really is an inherent part of being human and something we have a natural ability, if you like. So many of us are naturally mindful without going on a course, particularly if you like to spend a lot of time in nature. As we saw from the photograph, that can really help to bring us into the present moment. And often with pets as well, they can be really good teachers. Often, well, always they are fully present, actually. They're not thinking about what somebody just said to them or worrying about a deadline. They're very much present. So they can be really helpful teachers and naturally help us to connect with our natural awareness that we have. So with the rapid development of neuroscience, mindfulness has been shown to be one of four trainable dimensions of emotional well-being, with neuroscientists looking at what helps us to be well mentally, emotionally. And of course, that's not separate from our physical well-being. They're very closely connected. So it's been shown that mindfulness produces positive changes in the brain, which enables well-being and health. And the other dimensions as well have an underpinning of mindfulness to them. They are connection, insight, and purpose. And of course, we need mindfulness and awareness, presence to really help us to connect to ourselves, to each other, to our environment, and to give that that space for insight to arise when we're very caught up in thought or busy rushing around being more like human doings than human beings, as one of my teachers pointed out to me, then there isn't the space for insight to arise so much as when we give it that spaciousness in presence. And also for purpose as well, and to really aligning to what's important and meaningful to us, to make choices that really connect us with a sense of purpose, which then benefits our well-being. So these are all trainable qualities. And to help us develop mindfulness and these qualities, it can be helpful to think of anchors for our attention, and particularly when new to mindfulness, to notice which of these anchors, which of course are predominantly the senses, you're most able to connect with. It's important to say that mindfulness isn't a panacea, a cure-all, and there certainly isn't a one-size-fits-all approach to developing your mindfulness. Um, so, for example, I'm also a musician, so one of my anchors is sound, be it the sound of the rain on a window is a trigger to remind me to be present. And I can really anchor my attention to hearing the rain or the wind whistling around the building or musical instruments, my own, and sounds around me. So that's a helpful anchor for me. Perhaps if you're an artist, you can really anchor to the visual sense, um, or touch, or if you're a chef or you love cooking, maybe your sense of taste is a really helpful anchor for you. For some people, it's the breath, though others struggle with the breath. So really helpful to explore what works for you as an anchor, and crucially to practice training your attention to your anchors on a daily basis, which then trains these well, strengthens the wiring in the brain so that when you need to turn to an anchor in a moment of crisis or difficulty, that those pathways are already there. And then they're going to be more helpful for you to navigate difficulties. And again, the neuroscience has shown that this daily practice is very similar to other skills-based learning, such as learning a language or a musical instrument. So, and the more hours you put in, the bigger the change and the benefits that are possible. But I really think more and more we're looking at adaptation of in mindfulness teaching, because it can vary for so many people. So thinking of the body as an example, a body scan is a very popular practice a lot of people connect with. But for people, say, that are neurodiverse or have ADHD and struggle to sit or lie still for a long time, then their awareness or their anchor might be the body in movement or mindful walking, for example. So really, really important to find your way with it and to look at what's helpful and what's not. So, as a pharmacist, I was very interested in the evidence of mindfulness for health. And I first went to exploring the work of John Kabat-Zinn, who developed mindfulness-based stress reduction at the University of Massachusetts. And there's a lot of evidence now for MBSR, particularly in helping people to live with long-term conditions and chronic pain. So John Kabat-Zinn and his team have offered mindfulness-based stress reduction, or MBSR, in a medical setting, and often treating patients for whom the doctors couldn't do any more. John had realised that there were many conditions that couldn't be cured, and doctors would refer into his stress clinic for those where they'd reached the end of the therapeutic options. And things like chronic pain being such a difficult condition to live with. So that's where the evidence was really strong from the 1970s onwards with that work. And then later on came along mindfulness-based cognitive therapy, developed by a team of psychologists at the University of Oxford in the UK in the early 1990s. And from then, the research just became exponential, and a lot of evidence and interest in mindfulness for recurrent depression and to help our mental health and well-being. And there are many examples of ongoing research, and I'll point you to some of this if you want to read more widely after the session. And perhaps no surprise to see that conditions that are very closely linked to stress, such as irritable bowel syndrome, um, really respond well to mindfulness practice, and there's the evidence to support that. But everything from cancer, hypertension, inflammation, looking at reducing cognitive decline as we age, which is really important and also has a stress component, and influence on our behaviors, our health behaviors, and the choices we make. So, with that self awareness and seeing more closely what helps us and what doesn't, there is also evidence showing that mindfulness can help us make healthier choices. So I gradually began to see and to realize, and not least on that retreat with Thich Nhat Hanh, that mindfulness has a much broader potential than simply being for health or for depression. And the title for a course offered at the Oxford University Centre for Mindfulness is Mindfulness for Life, capturing that broader potential. And I think what I've started to see and appreciate more and more is this link between health and well-being, enabling learning, attainment, and flourishing. And then conversely, it works both ways, that our ability to learn, achieve, and to flourish then feeds into improving our health and well-being. So there's a broader impact of improving health and well-being, and we can move from a vicious circle or a negative cycle into a more virtuous circle or a positive cycle of health and well-being benefiting our quality of life, our achievements, and our achievements then feeding back into helping our wealth and health and well-being. And this all really is born out of a life of compassionate connection with ourselves, each other, and the environment, and living with meaning and purpose, as shown in those neuroscience-based trainable qualities of emotional well-being. So there's also a lot of research looking at some of these broader benefits of mindfulness. And in the UK, the Mindfulness Initiative brings together a lot of these resources, and they form the secretariat to a specialist all-party parliamentary group for mindfulness, advising UK Parliament, and looking at these different areas across health, the workplace, and how it helps us to reduce stress and perform well at work, and in politics and public life. So many politicians, peers, civil servants have experienced mindfulness courses and fed back how that's helped them in their political life. Looking at work in mindfulness in schools and also across the criminal justice system. And if you want to look at some of these areas and the evidence, you can look at the Mindfulness Initiative website, which is the mindfulnessinitiative.org. You see the address on the slide, and there's a publications page pointing to some of these resources. So my personal research and experience of practicing mindfulness, which I now would not live without, um, I really connect strongly with this quote from the neuroscientist and psychologist, Dr. Richard Davidson, who's been one of the leaders of a lot of the neuroscience research behind these trainable dimensions of well-being. And he says that he envisions a day when mental exercise will be as much a part of our daily lives as physical exercise and personal hygiene. And this is backed by that evidence of showing that this daily, regular mental training and there are different exercises or practices that can connect to the different dimensions of emotional well-being, and how that is as important for our health and well-being as being physically active and eating well, brushing our teeth, and so on. And the reason for this is that we are wired to survive, not to thrive, and that parts of the brain are common to our Stone Age ancestors that enabled them to survive. And those parts of the brain are active in the 21st century, and incredible, stress physiology that has helped us to survive all these years. But the same systems that would trigger us to fight, flee, freeze, play dead when there was a wild animal coming towards our pack are also triggered by the difficult colleague, the threatening email, the deadline. And these used to be on and off systems where there would be the fight, the flight, and then a period of rest and recovery. And in the modern world, this physiology is active more often, and that's where it can start to have a detrimental impact on our health. And I do remember hearing the psychologist, Professor Paul Gilbert, saying in various talks, the human brain is a mess. And I was really shocked by that. And I thought maybe he was having a bad day. Can that really be true? But actually, this is what he was talking about. And so, this daily training or practice is a way of helping us to address these unhelpful aspects of our brains. As John Kabat-Zinn said, we're the only species that gets in our own way. That we can, with daily training, mental exercises, actually optimize how our brains function and reduce how often we get in our own way, and learn to spend more time resting, digesting, and healing. The theme of this conference, of giving ourselves time to relax, and that can actually be seen as a skill. Another quote of Richard Davidson says, "Well-being is a skill," and certainly personally, it has felt like that. So maybe inviting you to explore for yourself and see if you agree or not. So the title for the book by the late Thich Nhat Hanh, "For a Future to be Possible," and in that book, he makes the case for mindfulness being what we need for a future to be possible. And this looks at the broader aspect of mindfulness in enabling agency. And there's a paper discussing this on the Mindfulness Initiative website, agency being intentional action. And it's about mindfulness giving us, we can see more clearly, we can discern how we act, how we live. It opens up choice, and that comes up a lot on mindfulness courses, that people really feel that they have more choice into how they live. And it empowers us to really to better manage our own health. And that also feeds into connecting with ourselves and with each other. And research is increasingly showing how toxic loneliness is, and how vital to our well-being it is that we connect with our communities, and more widely with nature, with living things, and really appreciating being in nature and how connected we are to nature. Examples of, say, sharing carbon dioxide and oxygen with trees, and without that oxygen, obviously we can't live. And the sun, and vitamin D being produced in the body when we spend time out in the sunshine, and really feeling that connection, ourselves, each other, and with nature. And that really helps with social change. And as you can see, that how that could bring about supportive environments and communities when we feel that connection. And leading into the possibility of sustainability as we really reconnect with the environment, and that leads to motivating us to really appreciate the importance of taking care of it. So if you'd like to read more about any of the issues, the evidence that I've highlighted today, the book I mentioned by Thich Nhat Hanh, and much of this session I've covered from a joint paper, a briefing paper that the Mindfulness Initiative and the Institute of Health Promotion and Education came together to produce in 2023. And you can find that briefing paper similarly at the Mindfulness Initiative.org website. And within that document, there are links to research and the evidence that we've discussed in the paper and that I've highlighted in this short session. So I'd like to thank you for joining me. Thank you to Professor Stephen Palmer and team for inviting me and putting on this incredible, much needed global conference, bringing together speakers and opportunities to practice relaxing together, and how much we need that. And I hope that you can take away at least one thing from this session to help you to live well. Thank you.